Good morning, everyone.
Good morning.
Good morning, everyone.
Good morning.
I know it's 7:30 in the morning. It's Wednesday. We're almost there to Friday, right? But thank you for coming out this morning. Eric and I have been presenting to at least 5,000 people the past 2 years in different groups, from PTOs to the Oscar Mayer board meeting to you guys today, the students. And I just want to be clear from the start. We want to be proactive and not reactive. So when you look at a report and you read these numbers and you hear our presentation, our goal is to be proactive. We want Madison and Dane County to be one of the best places in America to live and to stand up to its national ranking. So we're going to try to go through this pretty fast because we have a lot of information. Overview, we're going to talk about who we are. We're going to talk about our numbers, our findings, what we've been doing the past couple of years, and we're going to talk about some recommendations and some principles that we believe can help Madison become the place that we truly think we are. So, as Jennifer said, we're a project of WCCF. We receive funding from Annie Casey Foundation, which is this multi-billion-dollar endowed foundation out in Baltimore, Maryland. And because of Annie Casey, we have been able to provide this data without compromising what we believe in and without having too many hands in the kitchen or in the pots, right? So we're lucky to have Annie Casey as our sponsor. And we're staffed by a multi-racial team, Eric and myself. And in Madison and Dane County, that's pretty good when you have 50-50. And also we have interns and we have consultants. And believe it or not, we're trying to really be an example for a lot of organizations in the nonprofit and for-profit sector. So we practice what we preach. We're supported by a diverse volunteer cadre of local and national experts. So when you hear the numbers and some of the information in our report, this is not coming from Erica, myself, Doug Nelson, or Ken Teller. This is coming from different individuals throughout the country, local individuals here, organizations who have come together to help us form this report. And we're determined to add to the energy of the long history of folks who have been talking about racial disparities here in Dane County. We're not the first to talk about racial disparities. Hopefully we're the last to talk about it at this magnitude. The Urban League released a report in 2008 talking about the achievement gap and the tipping point. There was a report released by the governor not too long ago, but we want to be the last to talk about racial disparities. But the difference is we talk about racial disparities in a comprehensive approach. A lot of times you hear about racial disparities in silos. The achievement gap, health equities over here, economic disparities over here. In our report, you will find that we talk about it together because we believe that there's a cycle, they're connected. Unemployment, graduation rates, suspensions, it's all connected. So context. So one of the things we do know about Madison and Dane County is that it has been voted by various magazines, publications as one of the best places in America to live. So in 1996, CNN Money magazine voted Madison the best place in America to live and to raise a family. Same publication in 2007 voted Middleton. So I know you guys know where Middleton is, about 10 minutes up the road. CNN Money magazine voted Middleton the best place in America to live. In 2010, Farmers Insurance voted Dane County the most secure place in America to live. 2011, Men's Health magazine voted Madison the most educated place in America to live. 2012, USA Today voted Madison the best college sports town in America. So if you're a Badgers fan, that's good news. 2013, Madison was voted the 5th best foodie place in America. I have a vegan friend, and she may disagree with that ranking, coming from New York, but it was voted number 5. Dane County is also resource rich and progressively minded, right? So you have Oscar Mayer, that's not too far. You have Epic, you have St. Mary's, you have UW. It's the capital of Wisconsin. A lot of stuff goes on in Madison. There's a lot of smart people, like I said. PhDs, masters, athletic people. Madison, Dane County is resource rich. So when you look at these numbers, think about what's going on. But despite these positive attributes, Dane County has some of the highest racial disparities in America. Now, that's what some people don't believe. Not Dane County, not Madison. We're not talking about Milwaukee. We're talking about Dane County. We're talking about Madison. And this is a quote. Like many transplants from other U.S. cities to Madison, my husband and I were excited about raising our son in a college town that was known for inspiring intellectual activity and progressive politics. It was shocking to learn about the racial disparities in education and criminal justice in Madison, especially as the mother of an African-American boy. Addressing this issue is absolutely critical if I and other middle-class African-American families are going to invest our time, energy, and resources in Madison. So when we think about racial disparities, we always think about poverty, right? But it's clear from this quote that even middle-class and upper-middle-class African-American families are also struggling, surviving, and striving in Madison and Dane County, right? If it's the public schools, if it's entertainment, it's just not a poor or rich black thing, but middle-class African-Americans are also struggling in Madison. Goals, purpose, and vision of our project. So, past 2 years, first of all, our report was released October 2013 to about 500 individuals at the YWCA Racial Justice Summit. And since that date, we have given away about 2,000 reports, and that's not including how many times people have downloaded it online. But our goal is to collect, analyze, and track and disseminate this data, right? So we got this information from different sources. There's a saying, measure twice and cut once. That's what we've been doing. So when we released our report, we made sure that our numbers were accurate. And even before we released our report, people were coming up to us after we presented, said, can I get a copy of the PowerPoint? But we said, no, we got to make sure that this information is correct. So you will see in our report that some of the numbers are from 2010, 2011, but regardless if it's in 2008, 2002, disparities exist here in Madison. It's pretty bad. So the purpose is to use this information, right, to inspire and to allow and to encourage the community to be proactive. Again, when I started, I said we don't want to be reactive. It's not woe is me or, poor Madison, poor Dane County. But what can we do as a community? Seattle, Portland, Minneapolis, different cities, different counties have come together to say, what can we do as a community to improve the quality of life for individuals who live in our community and who want to move to our community? So if that's professionals, if that's poor, working class, what can we do? And then a vision, a more equitable, inclusive, diverse, and thriving Dane County. The magazines, publications that I mentioned earlier, CNN, Money Magazine, Farmers Insurance, Men's Health, that's great. But until Ebony and Jet and Latina, y'all know what magazines those are, right? Until they say Dane County or Madison is voted the best place in America for families of color to move and to relocate, that's when we know Madison, Dane County is a place for everyone. And it can be done. Columbus, Ohio was voted several times as one of the places for minorities, African American, Latinos to move to and to raise a family. So I know a city, a county the size of Dane County and Madison, it can be done. So past 18 months, we collected and analyzed this data, right? So we also gathered community feedback. Before we released the report, we wanted to make sure what was going on in the community. People knew about our report. There's the quantitative, right, the numbers that we all love, but then there's the qualitative, the stories, the experience of individuals, because you can interpret numbers any way you want. But when people start telling about their experiences and say, this is what happened to me, that's important. So we wanted to get the community feedback because Eric and I, we're both new to Madison. She moved out here about 5 years ago. I moved out here about 2 years ago from Atlanta. So again, we're experts in a certain way, but also we don't want to be condescending to the experience of people here in Madison County. And then getting advice from local and national experts. As I said earlier, it's just not the 2 or 3 of us in a room coming up with this information. Annie Casey, Race Matters Institute, different organizations and foundations have helped us and guided us to the information in this report, as well as local organizations. The Urban League, Central Hispanos, YWCA, those are all our partners. And then we put this all together for this report that A lot of you guys have heard about. Since the start of this year, we've probably been cited in the newspaper or other publications around 80 times. So every day we read the paper, someone cites race to equity, the report. That's, for some people, that may be a good thing, but for us, the more times we're cited, that means we still have a serious problem. So this is a snapshot of what Dane County looks like. So the total population is close to 500,000. And if you look at this, the number that stands out is Madison and Dane County is changing. It's no longer all white, majority white county. African Americans and Latinos are moving to Madison, right? For the same reasons that other families have moved. Quality of schools, healthcare, opportunities, employment. And so Madison, Dane County is changing. So some of the things that we used to do in the past will have to look different moving forward in the future. And the reason we started with African Americans and whites, we get that question often, is because when we looked at the numbers, the disparities between African Americans and whites were so large, right? So we had to start somewhere. And Erica could go into a little more, but it was just like, wow, this is Madison. The second reason, our team, there's only 2 of us, and now we have interns. And with the 2 of us, capacity, right? When you're dealing with numbers, you're dealing with information, it takes a lot of work. It took us 2 years just to publish this. And now we hired somebody to help us look at the numbers around Latinos. So I don't know when we'll release that report, but we also want to do a report around disparities with Latinos as well. So now Erica's going to dive into the data. So don't be discouraged. Let's think about ways we can be proactive.
Okay, can you guys hear me? Am I coming through the mic at all? No? Okay, well, I'll just try to yell as loud as I can. So my job in this presentation is to sort of hit you with a lot of numbers, and since you all are very smart, since you're in the medical field, I imagine you can hang through this. And this presentation is a little more expansive than the one we normally do, because I've tried to include a bunch of health indicators in it for a snapshot. So we've collected 40 plus indicators that are in our report, and basic demographics, which Torry just shared with you, economic well-being, family structure, health, education, child welfare, juvenile justice, and the criminal justice system. Can you hear me now? Yeah. Okay, great. So in the category of economic well-being, we compare whites and African Americans on 4 key measures: unemployment, median household income, poverty, and child poverty. So I'll start with unemployment. In 2011, the unemployment rate for African Americans in Dane County was estimated by the American Community Survey at about 25%, compared to 4.8% for whites. Dane County's 25% black unemployment rate is significantly and surprisingly higher than the national African American jobless rate of 18%, a fact especially relevant given the county's overall comparative well-being during the Great Recession. So if you had looked at Dane County in the aggregate in the Great Recession, it looked like it weathered it pretty well. But African Americans, in fact, were disproportionately hit by the Great Recession. Median household income. The median household income of Dane County's African American families was $20,664. This is less than a third the median income enjoyed by white families. This is also far lower here in Dane County than it is in the state, as well as in the nation, which the median income of African American households is $33,000. And again, we're updating these numbers right now to get the most recent. So hopefully those numbers will come out in 2015. Poverty. It shouldn't be a surprise that we have high poverty given high unemployment and low median household income. In 2011, ACS survey reported that 54% of all Dane County African Americans live below the poverty line, compared to 8.7% for whites. This means that you're 5 to 6 times more likely to be poor if you're African American than a white. And this poverty rate is higher than it is in the state. which is 43% for African Americans, and a higher poverty rate than for African Americans in Milwaukee County. And I think the interesting thing to think about here is that 8.7% poverty rate for whites probably includes a portion of white UW students who are filing their income taxes and would be considered poor as well. Child poverty. We have very, very high child poverty here. So if you take the 3-year ACS number, which is a little more conservative than the 1-year estimate, Black child poverty here is greater than 56%. That means an African American child is almost 11 times more likely to grow up poor here in Dane County than a white child. And this poverty rate here in Dane County for children, African American children, is higher than the national poverty rate for African Americans, which is 39%, and higher than the poverty rate for African American kids in the state as well. So we've been included family structure and some health indicators for you in particular to sort of frame out like aspects around the social determinants of health and have this bigger frame. And as we go through these indicators, I want to state that these indicators are not for the purpose of reinforcing stereotypes, but rather for the point of giving you a frame of our circumstance as a baseline here in this county, right? So family structure and family formation and parental education are often correlated with differential risks for household poverty and childhood disadvantage, right? So single parent households are likely to have less income, and therefore you're likely to have higher child poverty rates, okay? And lots of people say high teen pregnancy, higher child poverty rates, okay? Or those that are have less education. So birth to teen mothers. In 2010, 15% of African American births in Dane County were to teenage mothers compared to just over 2% for white births. This teenage birth rates are frequently cited, as I just said, as a major driver of child poverty. It is worth noting that Dane County's recent increase in African American child poverty rate occurred over a period in which African American teenage birth rate dropped significantly. So this traditional sort of policy correlation is not playing out here in Dane County when you look at family formation. So that's quickly a graph on birth to teens. Birth to unmarried mothers. 75% of Dane County African American births were to unmarried moms compared to 19.5% for whites. I believe the number for whites is actually probably increasing. The share of births to single mothers was, for African American mothers, was 3.8 times higher than for whites. However, the poverty rate for Black children was still almost 11 times higher, right? So that correlation is not, again, playing itself out. Now, births to mothers with a high school diploma, fewer than 3% of Dane County white infants, fewer than 3%, that's pretty incredible, were born to mothers without a high school diploma, while more than 20% of African American births were to moms without a high school diploma. 7.2 times more likely to have a mother without a diploma who has an African American baby than a white baby. However, it's interesting if you look at this next graph, we actually have a higher percentage of, or an almost even percentage of mothers with, let me back up. We have a higher percentage of mothers with a high school diploma that are African American here in Dane County than we do in the state of Wisconsin or in the nation. So again, this educational correlation to child poverty is not playing itself out. So health indicators. So I know this room is familiar with aspects around the social determinants of health, and interestingly, when we were going through the 40 indicators, health was our bright spot in terms of how people were faring, like Blacks and whites were faring in Dane County. So, uninsured. African Americans and whites who live in Dane County generally have higher rates of health insurance than their counterparts elsewhere in the state and the county as a whole. These higher rates of coverage may explain why both Black and whites living in the county tend to have better health status indicators than their counterparts elsewhere in the state and the county as a whole. So pretty well insured, but as you probably know, even if you're well insured, it doesn't necessarily mean that this translates to improved clinical outcomes, right? So we're not like doing better for African American rate of diabetes or any of those things, but we do have a higher rate of insurance, and I think in some ways that may translate to things like prenatal care. For example, the percent of births to mothers with sufficient prenatal care was higher here for both Black and white mothers in Dane County than that in the state and the nation as a whole. And yet, despite this good data, 3.6% of Dane County African American babies were born to mothers without sufficient prenatal care compared to only 0.6 of white births. So still there's disparity. It's 6.3 times more likely to have insufficient prenatal care than white mothers if you're an African American mother. So that's the graph. I'm speeding through these, but you can get them in more detail in the report. So African American babies in Dane County were almost 2.5 times more likely to be born low birth weight than white infants. And as you know, low birth weight translates into later health and well-being circumstances for children. And then, and lastly, it was interesting because the Journal Sentinel came out with an article yesterday that said that the disparities in life expectancy between African American women and white women in the nation as a whole has actually decreased since 1990. However, Wisconsin is the only state in the nation where African American and white women's life expectancy, the distance between them has actually increased. So again, like all of our indicators indicate, we're still sort of missing something here and not able to get in line or trending with the rest of the nation on many of these disparities. So lots of people talk about the school to prison pipeline, and from the Race to Equity Project's perspective, we sort of open up that pipeline broader to economic well-being, look at health factors as well, and how they influence education and later life success. So in this category, we compared African Americans on 4 key measures: third grade reading, rate of suspension, chronic absences, and students not graduating on time. So third graders not proficient in reading. In 2012, the third grade reading proficiency standard test indicated that 86.2% of African American third graders were not proficient in reading, compared to 47.6% of white third graders. That's horrible for both categories, but absolutely appalling for African American kids. And one of the things I always say is that from kindergarten to third grade, you learn to read. From third grade on, you read to learn. So if you're not where you need to be in third grade, the rest of your academic trajectory is one that's sort of trying to catch up, one that is somewhat frustrating, and I think obviously causes a lot of academic issues later on. And third grade reading is, in some states, used to determine future numbers of prison beds that are needed. That's how important third grade reading proficiency actually really is. So we gathered some numbers on rate of suspensions or expulsions for incidences unrelated to weapons or drugs. This is where you get an argument with a teacher or another classmate, and there's a determination that you should be suspended. And so in 2011, school suspensions of African American students in Dane County numbered 3,198 compared to 1,130 suspensions of white students. Suspensions were 15 times more likely to involve an African American student here than a white student. And I think in many ways these high disparities also reflect sort of academic frustration within the classroom. Like if you're constantly trying to keep up or get to the level that you think you need to be, there's going to be a lot of frustration and potential behavior. But nonetheless, that reflects just an appalling disparity in that. So students failing to graduate on time, I'm sure many of you are very familiar with our graduation rate disparities. 2010-2011 school year, this is in Madison's Metropolitan School District, because if you go to other districts within the county, the numbers become so small for African American graduation that they're not publicly available. So half of Madison's African American high school students failed to graduate on time, compared to 16% of white students. Black students were more than 3 times less likely to graduate on time than their white classmates, and this appears to be worse than the African American graduation rate for the state of Wisconsin as a whole, which is at 36%. So if you're not graduating, you're obviously not going to be taking the ACT, and you're not going on to post-secondary education, right? So this is going to, all this education disparities end up playing out in our economy as well. So we have what we call our deep end systems, the child welfare, juvenile justice, and adult corrections systems. And I think many of our economic and educational factors and disparities are feeding these deep end systems. So referrals to child protective services, which you may be familiar with as physicians and the like. In 2011, Dane County African American children were referred to child protective services at a rate of 196 per thousand, compared to 29.5 per thousand for white children. You're 6 times more likely to be referred if you're African American to child protective services than if you're white. Right? So that's our disparity in the comparison. Children in foster care during 2011. On a typical day in 2011, there are 124 Dane County African American children in foster care, compared to 58 white children. This suggests that African American children were approximately 15 times more likely to be in foster care than white children in Dane County. And if you look at things, there's disparity rates, but there's also disproportionality. Black children make up about 10% of the county's total child population, but they typically constituted nearly 60% of all those children in placement on a given day in 2011. Juvenile arrests. In 2010, Dane County black juveniles were arrested at a rate 6 times that of white juveniles. This disparity number, 6 to 1, is worse than it is for juvenile arrests in Wisconsin and in the nation. So if you look at those numbers, in 2010, we had 469 per 1,000 juvenile arrests. That takes into account duplicates, so kids that have been arrested multiple times, but still the number is very high. And in 2005, we had 864 per 1,000. So what in a positive light, what this shows is that between 2005 and the present, our juvenile justice system has worked really, really hard to reduce these disparities. And yet, they still exist, but concerted effort shows that you can make improvement. County secure detention. In 2011, Dane County black youths were sent to the detention center downtown at a rate of 102 per thousand, compared to 5.8 per thousand for white youths. This is a disparity ratio of 15 to 1. Black youths in Dane County made up 10% of the total population, but constituted 64% of our detention population. So that's what it looks like in terms of disproportionality. Lincoln Hills, that's after you've been adjudicated or sentenced in adult criminal court terms. Black youth were 25 times more likely to be sent to our state's correctional facility, and they made up 10% of the county's adolescent population, constituted nearly 80% of all local youth admitted to correctional facilities. Okay? So they're definitely disproportionately represented within the juvenile justice system. And then, we're moving forward into life trajectory, and now we have a new adult prison placements. Dane County African Americans were admitted to prison facilities at a rate 15 times greater than that for white adults. And if you didn't know this, there was a study done in Milwaukee that stated that Wisconsin has the highest African American male incarceration rate in the nation. So thinking about that, and then thinking about men with criminal records trying to get back into the community and then trying to get employed, this is we're in this cycle of trying to improve economic well-being, yet our high incarceration rates and the like is not necessarily allowing African American men to participate in our economy as they do in other places. And just the other thing to note is the Annie Casey Foundation in March came out with their own report called Race for Results, and it ranked the state of Wisconsin as last in the nation for African American child well-being. They have a different set of indicators that we do, but it really sort of buttresses the fact that Dane County may have some of the highest racial disparities in the nation. So what is this data telling us? Well, the distance between black and whites in Dane County is wider than almost any jurisdiction in the United States, urban, rural, north, or south. And what's interesting is that when we started this project, we had this hypothesis that we'd have high disparities, right? Because whites on average in Dane County do better than whites in the state of Wisconsin and do better than whites nationally, right? So our assumption was that we'd have these big gaps because whites were doing so well, and African Americans would be doing on par with other African Americans throughout the nation and the state. However, what we didn't expect, indicator after indicator after indicator, with the exception of the health ones, that in fact African Americans were doing worse. And so what's the expression, rising tide lifts all boats, that's not taking place here. In fact, we're tugging on either end. So we have some takeaways here. Like I said, far worse. African Americans are faring far worse here than they are in other places in the nation. And because of the strong correlation here, because of the high poverty rates, we have this racialization of disadvantage, where Dane County is a place where poverty and poor outcomes have an exceptionally strong correlation with race and color. Disadvantage here has become highly racialized. People often say, well, isn't this just a class issue and not a race issue? And can't we sort of separate them, extrapolate them from each other? And in fact, they are so correlated here in sort of our culture and in many ways, many of the statistical facts, that we cannot separate them and have separate conversations about it just being a class issue versus it just being a race issue. And this sort of racialization, has the consequence of fostering stereotyping, profiling, or differential expectations based on color. In other words, overt racism may not be what has led to these high disparities, but the continued perpetuation of these disparities will sort of reinforce stereotypes and potentially conscious racism. And as Torry alluded to earlier, this sort of correlation between low expectations and children of color, particularly in this case African American children, has a huge consequence for middle class African American families, because when you send your kids to the public schools, in many ways, there's this sensation, and we've learned this qualitatively, that your children get lumped in with these expectations of parents being poor, undereducated, and the like. And so lots of African American families send their kids to other school districts where in fact there's less kids of color, so that their children could be this exception to this, rule, for a lack of a better word, sort of culturally within our community. Okay. Local factors that are contributing to our exceptional disparity rates: the legacy of slavery, 2.5 centuries of bondage, segregation, racism, Jim Crow, and racism embedded in our attitudes, economy, politics, institutional practices, and social structures. In other words, institutional and structural racism have disadvantaged African Americans and privileged white Americans, not only here, but throughout the nation, right? And that's a broad, universal factor. But we have some local ones, okay, that we believe are feeding into this. That's a labor market mismatch, where we have exceptional mismatch between the county's major labor markets, skill readiness expectations, support networks, and credentials for many job seekers. There are far too few routes for family supporting jobs for folks that have less education, less network, and less technology experienced workers. In other words, I think people take for granted here the fact that when you put out a job posting, you're likely to get a lot of candidates that have masters, even though the job may technically not require a master's degree. So we have highly credentialed people, numerous people that have PhDs. You know, the urban myth that PhDs are driving cabs is actually true here. And so you end up having almost overqualified people occupying entry-level positions, where in other cities and localities that's not the case. So it's really hard to break into entry-level positions, especially if you don't have a BA or a master's degree, and you don't have a group of people to call upon to find out where the next best job is or who's going to interview you. I mean, I think a lot of people take advantage that this is a highly networking community. So you want a job, you ask around, people call you and say, hey, there's this job opening. And by the way, when you go into the interview, tell them you love to kayak, because that, you know what I mean? I mean, these are the sort of things that we take for granted, and so all of a sudden you become a kayak expert in preparation for the interview because you got all this information through your networks, right? And there are a lot of folks that don't have that opportunity.
And also to add, I don't know if you guys saw the article last week about the 3 African-American women who work for Metro,
Yeah.
and they were talking about the nepotism that takes place in the city and other government, whatever, entities. That's real, right? We can talk about merits. The lady says she scored 104 out of 112, but because she didn't know somebody. So it's not always a person that's not qualified, it's also the social capital that you bring. And then when you have some African Americans and Latinos who do move to Madison, they may be overqualified, where they should be executives, but then they are asked to be coordinators, right? And so it's not only being entry level, but it's also the ones who are qualified, who comes because of a spouse.
And just to add to that, in many, like traditionally, African Americans enter the middle class through government jobs, right? And 30% of African Americans throughout the nation, according to the Bureau of Labor Statistics, have entered the workforce through government jobs. That is not how our city, county, and state government workforce is reflected. So even that traditional way of sort of entering the middle class and creating networks does not exist. Another one of our local factors, and I'll speed through these, is neighborhood isolation. Many folks live in scattered, small, socially isolated residential concentrations that lack family supporting institutions and networks. If you're familiar with big cities like New York City, Chicago, whatever, African American neighborhoods, even with high concentrations of poverty, are vast. They're not 2 blocks long, they are like 40 blocks long with hundreds of thousands of people in them, and as Torry said, a lot of social capital. Churches, grocery stores, places of employment, neighborhood schools that their kids can walk to, transportation within the neighborhood. So the neighborhood itself has this degree of vitality and its own community of support. And here, despite past efforts to sort of integrate and the like throughout the Dane County history, there are small pockets of low-income folks of color who are surrounded by white middle-class houses with no access, transportation, or sort of community links to places of employment. Lots of kids get on buses to go to school. They are not walking to their neighborhood school to create that sense of community. And that's one of the things that we think is also driving these disparities. Capacity for our building for our family and child serving systems. This is a need to increase resources and levels of competence for social workers and teachers in our community, so they have better capacity to deal with the strengths and the needs of some of these low-income families of color. What we need to do, we need to promote financial security and employment and economic inclusion through more pathways to family supporting careers. There's not just unemployment, but there's those folks that are really severely underemployed as well that still cannot support their household. And if we have parents who are employed with children in the school system, a less stressed child in terms of home environment, because of economic well-being, because of access to health, is a better student, right? Because they're dealing with a lot of stuff if there's stress at home. So this is sort of what we refer to as the 2-generation strategy. You have to focus on the parents as much as you do the children, because you can invest millions and millions and millions of dollars into our public education system, and yet still fall short of the goals that we want because the parents themselves are struggling, right? Strengthen neighborhoods, these isolated neighborhoods, and increase leadership opportunities and opportunities for family supporting resources and social networks. Increase equity and educational opportunity and achievement. If we have earlier and more effective intervention in the lives of our youngest children, sort of the 0 to 8 theory about focusing on those young children, they will be more prepared and more proficient in 3rd grade and then able to go on to graduate high school and post-secondary education. Strengthen our professional practice in our helping or serving areas, and that's child welfare, juvenile justice, the court systems. And now I'm going to hand it back over to Torry. So that was the data in a snapshot that gives you this really broad picture of where we are as a county for disparities.
So we have like 2 minutes. So these are our principles and values, right? So we want to engage families and communities most effectively. A lot of times we think about the whole, we need to do this for the entire city, the entire county. But if we know that there's targeted areas that need more resources, let's target these areas and let's engage these families. One of the things we've been able to do in the last 2 months is start a program, a fellowship that we call Community Ambassadors. Because the information that we have in this room that you all just saw, we want to make sure the folks who are impacted the most by these racial disparities, they have this information. They're able to have these conversations and give feedback and say, this is what we need to do as a community. These are our concerns. This is really going on. What can we do as a community? So we have a program called Community Ambassadors, and that's to engage these families and communities that's effective the most. A 2-generation model strategy, right? It's not only the child. We always want to engage the children. Children are cute, right? Innocent. But what about the parents? You know, you got to understand what's going on in the household. You have to figure out how to employ these parents, how to educate these parents. So let's not only concentrate on the children, but also the parents. And the comprehensive and collaborative and not siloed. Again, let's not look at racial disparities, achievement gaps, juvenile justice, economic well-being, but let's look at it as a whole and let's have these conversations come together, right? Because they're all connected. And then I talked about targeted sense of urgency, right? We talked about slavery, we talked about discrimination, we talked about racism. That's 200, 400 years. So this won't be done overnight and it won't be a cheap investment, right? It's not 100,000, that's 200,000. Jeffrey Canada, who's in New York, who just resigned not too long ago, runs an organization called the Harlem Children's Zone. Each year he raises over $100 million for his organization to reduce racial disparities in this neighborhood in Harlem. $100 million, right? Madison, it's a sense of urgency, it's a long-term commitment, and we have to invest in this. So one thing we do know is that Madison is resource rich. We have talent here. There's leaders here. So we know we can do it. And again, the stat that I mentioned earlier, we have the most PhDs and masters of any town or city in America. The scale of the problem is manageable. We're talking about 20,000 individuals. We're not talking about 1 million. Philly, Chicago, these are major cities. LA, Oakland. We're talking about 20,000 individuals, right? We can do it. It's not. It won't take a rocket scientist to figure this out. We have rocket scientists here. It would just take an effort of all of us to come together to figure this thing out. Again, it's manageable. It impacts all of us, right? We don't want our children growing up in Madison, the first time they see a Barack Obama, Michelle Obama is when they get to college. We want to raise global citizens. And that's the world. I read a book called Privilege by a guy named James Hahn, and he talked about St. Paul, which is a boarding school. The boarding school has changed since the 1980s. You have students from all across the world attending this school. Now, if that's going on in a boarding school, and they know that diversity and that the quality of life for everyone is important, it's important that we as Madison, we understand that it's important that well, it's important that we understand that this is about our children and it's about our community as a whole, that if we can consider ourselves to be a world-class city, we need to come together. I mentioned earlier how we need to be proactive. There's a couple initiatives that have taken place. The mayor, he has a couple things. He has his racial and equity initiative at the city. The county executive also has done something around early child development. United Way, after the release of our report, they have looked at how they're giving out grants. UW-Madison, I just came from a meeting last week. They're also looking at ways whether or not their professors, their research is looking at opportunity gaps and the achievement gap. You also have the school district. Erica mentioned the school suspensions. They have changed their policies around the suspensions. The board voted that earlier this year. You also have FCI, for community investment. They're trying to diversify their staff as well. So a lot of changes happening here in Madison and Dane County since the release of our report, and there's a lot of more change that needs to happen here in Madison and Dane County. But we like to end on this quote. 4 years ago, I decided Dane County was the place I wanted to raise my children because it was truly a great place to live, right? As a single mom, I found a terrific job, have been pleased with the education my children have received, but I know that our experiences isn't the experience of all families. Our community is poised to respond to these concerns because one of the best things about living here is the people. The people truly care, our neighbors want to make a difference, our community is at a tipping point of becoming the community it thought it once was.
I have one more thing to add. And I'm gonna cheat here because I have my phone, but you know, from the medical or perspective and being doctors, I think that there are a lot of stuff that you can do individually. I mean, one, we talk about sort of what you can do personally and thinking about your own biases, especially when people come into your office. And you know, there's a lot of work that you can do professionally within your own departments in order to have these discussions about equity and in thinking about where there are opportunities to get diversify your workforce, become more inclusive. Who are you reaching out to? How do you expand your networks? Are you calling? Do you have a relationship with people at the YWCA or at the Urban League of Greater Madison and other sort of, or MATC and their programs, and how robust and how well is that working? You know, some reflection on that in order to sort of increase your workforce, because the people that you serve are going to become increasingly more and more diverse. And from specifically, you know, there's medical legal partnerships, and I know there's some sproutings of that within UW and the clinic, but really intense medical legal partnerships in which there's like a lawyer embedded within the hospital who you can make the referral to when you're talking with a patient and you're going to ask them all these medical questions, but can you think about what else is in the potential prescription that you're writing? In other words, are you asking them, do they have stable housing? How are their children doing educationally? Do they have employment? Do they have enough money to pay their energy bills, right? Because if people aren't getting heating, if they're not getting air conditioning, if their rugs are filled with mold and their house is infested with cockroaches, this is impacting what you're seeing over and over. And these folks that are struggling with these issues are the ones that come in repeatedly and repeatedly and repeatedly. So in some ways, you can take that opportunity. If you're not going to write them a prescription for something clinical or medicinal, you write a prescription for, here's legal services if you're going to get evicted, right? I mean, you have your list of other resources for them outside your medical purview in order so that some of the things that are driving them into the clinics and the hospitals can be addressed better at the base. And that could be part of your prescription, you know? And I think trying to figure out, do you ask those questions? Do you take the extra 5 minutes to do it? I think are as important when we're talking about the social determinants of health and addressing many of these disparities, right? So that's the last thing. Thank you very much for listening to all this intense, overwhelming information, as we know it is. So thank you. We appreciate you taking the time this morning.